Hello, my name is Keisha Gerpiel, and I will be presenting death, funeral, mourning, and family roles.
Hi, my name is Ashley Fordyce. I will be speaking about high-risk health behaviors, healthcare in Ethiopia, and spirituality.
Hi, my name is Kudira Takitoye. I'll be talking about communication, pregnancy and childbirth practice, and nutrition. So I'll start with communication first. Verbal communication. So indirect communication. Ethiopians tend to be non-confrontational and highly considerate of others during communication. Therefore, they generally resist saying things that could be perceived as embarrassing for others. It is common for Ethiopians to understate their opinion in an effort to remain polite and harmonious. Refusers. Ethiopians can be quite hesitant to give direct refusal, especially when asked to perform a favor by a friend. This can mean that they agree to do something they do not want to do or cannot do in order to avoid sounding rude. Language style. Ethiopians pride themselves on their eloquent speaking style and expect others to speak clearly and use metaphor, allusion, and innuendos. They often use exaggerated phrases to emphasize a point. Apologies. Ethiopians may not give direct apologies by explicitly saying, I am sorry. Often, people will show their regret through their follow-ups action. Sounds. Trilling of the tongue is an expression of excitement or happiness. This sound, this sound is commonly used at celebrations such as weddings. Gratitude. Thank you are often given in form of a blessing. For example, rather than saying thank you so much for your help, an Ethiopian might say, may God help you as generously as you've helped me. Tone. Ethiopians generally speak with quiet, soft tones. Loud volume can be seen as too aggressive. Humor. Ethiopians love to laugh and enjoy jokes. However, sarcasm and irony may be misinterpreted during the first hour of discussion. Non-verbal. Physical contact. It is common for people of the same gender to touch one another while talking. Greetings are often affectionate with hugs and kisses exchanged. However, physical contact between genders is generally kept to minimum. Romantic affection is rarely seen in public. Eye contact. Direct contact is normal and expected. People may look away intermittently to avoid prolonged stares. Lowering gaze away from a person's face is a sign of respect towards elders and superiors. Facial expression. Ethiopians are generally animated people. Their emotions are often expressed through facial expressions. Pointing. It is inappropriate to point with finger or foot or point directly at a person. Pointing at someone with left hand is especially rude. Nodding. Quick nods of the head indicates agreement, while nodding slowly can indicate reflection or sorrow.
High-risk health behaviors. The main health concerns in Ethiopia include maternal mortality, malaria, tuberculosis, and HIV/AIDS, compounded by acute malnutrition and lack of access to clean water and sanitation. While Ethiopia has made significant progress in reducing maternal mortality and combating HIV, malaria, and other diseases, challenges remain. The limited number of health institutions, inefficient distribution of medical supplies, and disparity between rural and urban areas due to severe underfunding of the health sector make access to healthcare services very difficult. Maternal and child deaths have been in decline since 2000, but maternal and newborn mortality remain unacceptably high. The annual maternal deaths are 353 per 1,000 live births. Contributing to this number is the lack of access to quality prenatal, obstetric, and postnatal health services, especially in rural areas. Reducing newborn deaths within the first 28 days remains a challenge. Adolescent girls are highly affected by female genital mutilation and cutting, as well as child marriage. The country has the second highest number of girls and women in the world having undergone female genital mutilation and cutting, with 23.8 million girls and women aged 15 to 49 having undergone this procedure. 17% of girls aged 15 to 19 are married.
Death. In the Ethiopian culture, illness is not openly discussed until it becomes apparent, such as speech slurring or becoming very frail. Often the patient or the individual will ask that the partner or family is not told by the healthcare provider about their illness or condition. In this culture, they have a strong belief in continuation in life after death, but they do not openly discuss death either. If a healthcare worker were to discuss death with the family regarding the patient, it is seen as putting a curse or bad luck on the family and is extremely frowned upon. Often the family will have a lot of denial to the individual's death and will keep the patient in the hospital for as long as possible to get continued care in the hopes that they will get better. When an individual dies, the rest of the family is not contacted directly. Rather, they contact a close friend who will gather and organize elderly and respected community members to go to the person's home to talk to them as a group. When someone is sick in the hospital, the whole community is so connected that all the members will come to the hospital and a huge turnout will be present. The funeral is arranged by the community, and arrangements only happen after the individual has passed and the grieving stage for the family has passed as well. Caskets are made out of wood and are covered in a cotton fabric garment, and the majority of Ethiopians are Orthodox Christians and have according religious church funerals. At the funeral service, women are very expressive in their grief and will display wailing cries, beating of the chest, throwing themselves to the ground, and in some cases will scratch themselves or pull their hair out. Men are seen as weak if they are suffering with pain or seen crying. Often comments will be made to them that they are a girl or a woman. The community will also come to the home to pay respects to an altar. It is customary that the family will make a memorial for the lost individual with candles, photos, and flowers in the home to commemorate the lost person.
Spirituality. Ethiopia has a long historical and cultural connection to both Christianity and Islam. Roughly 2/3 of the Ethiopian population identifies as Christian and 1/3 is Muslim. The Ethiopian Orthodox Tewahedo Church is one of the oldest and earliest Christian bodies in the world. It is generally considered to be the traditional religion of the land and is closely correlated with the national identity. For most Ethiopian Orthodox Christians, faith is deeply important to their day-to-day life as well as to their identity. There is a common traditional belief in the evil eye or Buddha among both Christian and Muslim Ethiopians. This is the belief that one's misfortune is caused by another's envy, sometimes taking the form of a curse. For example, many believe that too much admiration of a child can cause the evil eye to become jealous and curse it, making the baby sick. Ethiopian Christians may also believe in divine healings, exorcisms, and direct revelations from God. Demons are often thought to be the cause of illness or ailments. Therefore, spiritual healing is an important treatment for many Ethiopians. This can involve holy water ceremonies and meditation and reflection over a fasting period.
Pregnancy. Pregnancy is usually not discussed until it is noticeable. In Ethiopia, women are helped through pregnancy by their mother and other female family members, friends, and neighbors. Women do household chores and work as usual until they give birth. There is a belief that keeping active will quicken labor. If the baby is the woman's first, she would go to her parent home in the 8th month to relax and prepare for birth. Rural and urban women observe this custom. It is considered bad luck to buy items for baby until it is born. It is also considered impractical to buy clothes for the baby before the gender is known. It is not culturally acceptable for a woman to be pregnant and unmarried because it will bring shame to the family. Hot mustard is avoided during pregnancy as it is rumored to cause miscarriage. Warm food are eaten during pregnancy and postpartum. Childbearing practices. During labor, friends and families of the mother-to-be ritually roast and drink coffee and burn incense. Men are not present during labor. If a woman is in labor, if a woman is in labor, she might notify her mother or female friend, but not her husband. In rural areas, babies are born with assistance of a midwife, who is a member of the mother's community. Other women can be present up until the point of labor. When it is just the woman, a mother, the midwife, and her helpers, such as neighbors who are especially experienced with childbirth. In the cities, women may have prenatal care if affordable, provided by a clinic or hospital. Cesarean sections are done in the cities but are not common and are never performed by midwife. In Orthodox Christian communities, women will gather outside the home to pray when the mother's painful screams are heard, the women begin to say special prayers to Virgin Mary. When the baby is born, these women will make series of loud sounds to broadcast the arrival and the gender of the baby. 5 times to announce a boy and 7 times to announce a girl.
Family roles and organization. The household structure and roles are divided strongly by gender and traditional thinking. Women and girls are solely responsible for the household work, while men are seen as the providers doing outside work and hold the most authority. For men to do any household chores, it is deemed shameful, and for women to do farm work, it is referred to not being a proper lady. It is customary that multiple generations live together, the eldest couple, their sons with wives, and any young children they may have. Some sons will move into new homes with their wives, but often multiple generations and families will live in the same home and share resources. The role of the family is extremely important in this culture and highly respected. In society, parents and elders are expected to be respected, and disobedience or disrespect is punished harshly. The elder family members are expected to be taken care of by their children. Placing elderly in a home is deemed disrespectful and unheard of. The culture still has remnants of practices that are now deemed illegal. In some areas, marriage of young girls, female genital mutilation, and the taking of a woman's inheritance is still being done. Although now in urban areas, gender roles are not as rigid, and men and women will partake in some cases in domestic chores and income earning together.
Healthcare in Ethiopia. Ethiopia's health service is structured into a 3-tier system: primary, secondary, and tertiary levels of care. The primary level of care includes primary hospitals, health centers, and health posts. The secondary level of care consists of general hospitals that serve 1 to 1.5 million people. The tertiary level of care consists of specialized hospitals that serve 3.5 to 5 million people. Only major cities have hospitals with full-time physicians, and most of the hospitals are in Addis Ababa, Ethiopia's capital city. Access to modern healthcare is very limited, and in many rural areas, it is virtually non-existent. Most facilities are government-owned, and medical schools in the country continue to graduate general practitioners and few specialists. This is not meeting the rising demand of health services. Healthcare is also faced with shortages of equipment and drugs. This also causes persistent problems in the country. Traditional healing, including such specialized occupations as bone setting, midwifery, and minor surgery, continue to be useful. Women are socially pressured to become mothers without the proper infrastructure and care to support her throughout her pregnancy, the birth, and then the infant's health. Mothers must rely on their communities to transport them to health posts and health centers that are understaffed, under-resourced, and cannot support the mother properly. Many infants and children do not make it past the age of 5 due to diarrheal disease, acute respiratory infection, and lack of proper vaccination.
Nutrition. Ethiopia has seen a steady reduction in stunting from 58% in 2000 and 38% in 2016, in the percentage of underweight children from 41%. These trends indicate an improvement in chronic malnutrition over the past 15 years. Yet, 28% of child deaths in Ethiopia are associated with undernutrition. High prevalence of various forms of malnutrition among vulnerable groups has serious implications for social development and economic growth. Among women aged 15 to 49 years, 26% are undernourished and 24% have anemia. Micronutrient deficiency in iron, vitamin A, folic acid, iodine, and zinc remain the most common. The preferred staple in Ethiopia and Eritrean diet is injera, a flat sour-like fermented pancake that is used with what? A stew made with spices, meat, and pulses such as lentils, beans, and split peas. In Ethiopia and Eritrea, teff is the most cereal crop used to make injera. Ethiopia has beliefs and attitudes relating to food. Some of these are related to food and disease, others to qualities such as cold and hot, or light and heavy foods. Some foods are endowed with special prestige. Food items in Ethiopia. Cereal. The most important cereal are teff, corn, sorghum, belly wheat, and millet. Teff is a native to Ethiopia. A number of varieties are available. The most common are white, red, and a mixture of these two. Legumes. The next group of importance is legumes. The most common being chickpeas, feed peas, lentils, and broad beans. Vegetables such as onions are grown in large areas and used in huge quantities. Tubers, potatoes, sweet potatoes, and in the Oromo communities. Oromo potatoes are used in staple diet. Milk. The amount of milk per cow is small. Fresh milk is mainly given to small children. Sour milk, butter, and low-fat sour milk cheese are made from milk. Meat. The meat of the cow, sheep, or goat is eaten in the staple diet. Wealthy families can afford to serve this kind of food often, but majority of the population can serve meat only on ceremonial occasions. Fish, tilapia and Nile perch are available in lakes. Fish is often of very little importance in the staple diet because of poor transportation system. So this concludes the presentation, the cultural presentation.
Thank you for watching. If you look through the next 3 slides, you will see Kudarat, Keisha's, and my references.